Well, the state of Washington is in a self-described crisis, dealing with the biggest backlog in state history of mentally ill people sitting in jails. And like in Oregon, they are waiting for legally mandated medical help. These wait times setting new records, creating essentially a combination of chaos, suffering, and a growing financial toll. And as Susanna Frame from our sister station King 5 in Seattle explains, even judges say the system is failing.
Sir, let me explain my expectations in the courtroom.
Expectations You're fired.
Over the last several months,
Your Honor, the suffering here is egregious.
our cameras were rolling
I have anxiety.
as a record number of defendants deemed incompetent to stand trial filed into court.
He has now been incarcerated 4 months.
People with mental illnesses so severe they don't understand the charges against them.
It looks to me like maybe you're hearing voices today. Am I right about that? Yeah.
We are asking the court to dismiss this case.
We saw defense attorneys routinely asking judges to throw out the charges
The defense is asking the court respectfully to dismiss the charges.
because their clients are sick and languishing in jail without mental health treatment for lengths of time never seen before in the state of Washington. Alexander J. of Seattle is one of those defendants.
The amount of time that Mr. J is being required to wait is barbaric.
In April, a judge found he was incompetent to stand trial and ordered he be sent to Western State Hospital in Steilacoom to try to get stabilized. The treatment's called competency restoration. The court ruled Jay needed to be out of jail and in the hospital within 7 days. But he's been waiting behind bars for more than 7 months.
It's unbelievable. You want it to be done.
Kim Hayes is one of Jay's alleged victims. A light rail security camera captured this random attack in March as she was going to work as a trauma nurse at Harborview. Her clavicle and ribs were broken, and she thought she could have been killed.
Can you characterize or put into words what this whole experience has done to you?
It has changed my life.
Kim says the state's delays are unacceptable for everyone.
I want to move on with my life, but I would move on quicker if we, for him, that resolution of getting him into an appropriate bed, an appropriate place.
You think you could heal faster?
Yeah, oh, absolutely.
In a 2015 order, federal judge Marcia Peckman ruled the state is violating the constitutional rights of some of its most vulnerable citizens, that jails are not hospitals, and the mentally ill are being warehoused while they wait for services. Peckman ordered DSHS to provide inpatient treatment within 7 days of a judge ruling the help is needed. But that hasn't happened. Despite the judge's order and millions of extra dollars spent on resources, we found the state's wait times have gotten worse, not better. State records show in 2015, the average wait time for a bed at Western was less than a month. In 2022, that wait has shot up to 4 months and longer.
Would you ever have imagined that in 2022 we'd be in this place?
Absolutely not.
ACLU's legal director, LaRon Baker, was one of the attorneys on the case that led to the 7-day timeline.
I didn't think there was a universe in which a state agency would just really renege on their obligations. It's a real human tragedy.
A year after the federal court ruling, Judge Peckman railed against the state for not doing better, writing DSHS needed to stop the procrastination and false promises. She ruled the state in contempt and leveled fines for not meeting deadlines. From 2016 to 2018, that cost DSHS $88 million. After that, a settlement agreement put the fines on hold, but they're still accumulating. Records we've compiled show if it all has to be paid, the total bill would now be more than $300 million.
I put together this database.
Doctors Brian Wablinger and Thomas Kinlan are the state's top officials overseeing Western State Hospital.
That's the total. What do you think of that?
Unbelievable.
Would you say that the state is in a crisis?
A competency crisis for sure.
This has got to be difficult.
Oh, it's crushing. It's disheartening.
The doctors say this year the state was hit with a perfect storm, including the effects of COVID. After several shutdowns in hospital admissions, a backlog of cases are now coming through. Also, staffing is at historic lows. At Western State, about a quarter of the jobs are sitting unfilled.
I'm being subjected to solitary confinement.
And more than anything, they say there's a whopping increase in need. In the last year alone, Western saw demand for competency treatment skyrocket by 40%.
We knew ahead of time that services would be increasing over time. We knew that. What happened recently, we don't understand that. I don't think anyone expected that to happen.
DSHS is working to build new bed space. This project at Western State will add dozens of new spots next year. And they're building in Thurston and Clark counties, trying to decrease wait times for patients and decrease the likelihood of getting dragged back to court to pay the piled up fines.
We have to be fiscally mindful, and having to pay $300 million would be, that's the taxpayers' dollars. So of course it's concerning.
I am finding the department in contempt.
Judges are clearly fed up, saying the state's efforts aren't enough for defendants, taxpayers, and victims alike.
The delay imposed by the government is unconscionable, and it is inconsistent with the behavior of a civilized society. It is absolutely outrageous.
They've got to pay the price for not providing this, especially, human care to people who need it, this mental health care. The longer this process goes on, it does take away your belief in the system, and it affects so many people.
Yeah, that video there, really hard to watch. By the way, the tens of millions of dollars in fines the state has already paid have gone toward improving the system, creating what are called diversion programs to help people with mental illness before crimes are committed. But those efforts don't appear to have been enough to keep the wait times from reaching those record levels. Now, as Susanna mentioned, there is a new facility coming to Clark County. It'll serve 48 patients near Vancouver, though it is not scheduled to open until 2024.